We've got a good crowd here. I'm really glad to see all of you here. There's a few more seats down here in front on this side, so don't be afraid. It's like in church. You have to come to the front now. So there's a few seats over here. There's a few seats towards the back on this side.
Just tell them they can't see the screen on that side.
Yeah. Well, the things that you're going to see on the screen are on the handout. So hopefully does everybody have a handout? Okay. And there's some seats back here in the back in the middle. So if you want to get over here so you can see better, we can get you in those middle seats in the back. Okay. My name is Beth Jones, and I'm the Associate Vice President for Finance and Administration here at Georgia State. And one of the areas that I'm over is the benefits payroll area, and so we've been working really hard with the University System of Georgia to make sure that you have all the information you need for this change in the health care plans for retirees. And one of the questions that I've gotten this morning when I've walked around is, so are all of our questions going to be answered? And the message is that Karen's going to try. She's going to try, and she'll give you instructions too on how to write down your questions as we go through the presentation, and then we'll have time at the end that we'll try to get these questions answered for you, and then some of them they may have to take back and do an FAQ. But right now I'm going to introduce Karen Elliott. She's the Associate Vice Chancellor at the University System of Georgia, and she's going to introduce the program and how this process is going to work. And we're going to do our best here at Georgia State to continue to take care of our retirees. So without further ado, I'll give you Karen, and she'll introduce the rest of the program. Thank you for coming. We appreciate it. And our restrooms are out the door down the few steps to the right. So if you have any problems, we have 1913 students here that can help answer your questions, and we have staff here from the benefits office. So please let us know if you have any problems or anything that we can help you with. We'll do our best.
Good morning. It's great to see all of you here today. I just want to make sure, some of you that are sitting there, if you can't see the screen, you may want to move back a little bit. Some of the information that you have in your handout, or you don't have all the slides in your handout. So there's just, the important slides are definitely in your hands, but we'll have much more information that we'll be covering today. So let me just say a couple of housekeeping items. You should have received an index card when you came in, and so we will ask that you save all of your questions till the end. If you could, write down any questions that you have through the presentation on that index card, and then at the end of the presentation, we'll open it up for questions, and we'll ask you to pass the card to the middle of the aisles, and the students will be taking your questions, and we will answer them at that time. So we have had plenty of time in our other meetings, and we'll stay here as long as you need us to answer all of your questions. Let's see. I want to thank all of you for being here today to hear some very important information about your health care coverage, your supplemental health care coverage for 2016. And as Beth said, my name is Karen Elliott. I'm the Associate Vice Chancellor for Total Rewards at the University System Office. And with me today, I have Tammy. She is a Aon Benefits Advisor, and she will be, together, we will be presenting the information today about the new coverage for 2016. One comment that I want to make before we get started is I want to just talk a little bit about the meetings that we're doing in August and September, just like we did in April, and hopefully many of you were at our April meetings. We are meeting with all of our retirees across the system. We are traveling to every institution, and it's really important to us that we meet with you and that we hear your questions and concerns. We know that we have a very diverse group of retirees. we have a lot of unique situations. And so we want to make sure throughout this process that we're meeting your needs, okay? One of the things that we did during the April meetings is we asked for volunteers, retiree volunteers, to work with us, our office, over the summer to provide us feedback about some of the communications and the enrollment process. And we did get volunteers from every institution, and our office has been working with these volunteers over the summer. And we had some from Georgia State. Hopefully they won't mind me saying their names, but Ann McKillips, Patricia Dunkel, Jeff Walker, Marty Waterfill, Diane Walker, and David McCreary. So those retirees from Georgia State have been working with us. We really appreciate the time that they've taken. Again, we've had them review some communications and help us understand what our retirees are concerned about as you hear about this change that we're making. One of the things that we did a couple weeks ago is we had these retirees listen into a sample call of what a retiree will go through when they're talking to that benefits advisor over the phone, and we had them give us some of their thoughts and comments. And I think it was very helpful for our office, and it was also very helpful for Aon. So we know these are the things that we need to address during the calls. And I think it was very helpful for those retirees too. It made them feel much more at ease when they heard how those enrollment calls will go. So just want to let you know that that is very, very important to us. And then one other thing I wanted to mention is that the enrollment process will happen over the phone. But I did talk to Gail from the benefits office here at Georgia State, and they've offered to have a drop-in time here at Georgia State. So if for any reason you don't have, let's say you don't have a relative or somebody that you can talk over this decision, if you want somebody to talk to or have any kind of questions, they are going to have a drop-in time or a day, maybe one day a week, and they'll get that information out to you. So if you really feel like you want to talk to somebody, their office is going to be there to support you, okay? And if you have any concerns, please don't hesitate to reach out to my office. We want to hear from you if you have any issues throughout this process. So why are we here today? We are here to talk about and give you information so you're prepared to enroll for your new coverage in 2016. It's our office, it's my priority, and it's also Aon's priority that you have all of the tools, resources, information so you can make that important enrollment decision for 2016. In June, every Medicare-eligible retiree should have received a 2015-2016 Medicare-eligible retiree insurance guide in the mail, okay? If you did not receive that guide, if you could please see us after the meeting so we can get your name and address and make sure that we have all of your correct information. In that guide, there was information about, the same information that was in that guide was information that we covered during the April meetings. So you have that information, and we will be building on that information during today's meeting. And so we will be preparing you for your enrollment. What we will be covering today is I will be talking about what is changing for 2016. And I'll be giving you some information about the funds that you will be receiving into your health reimbursement account and talk about the requirements for receiving those funds. So there's a couple of rules that we need to go through. And then I'm going to turn it over to Tammy, and she's going to lead us through the rest of the presentation talking about the health exchange and the options that you're going to have available to you in 2016, and how the enrollment process will work, and how you're going to pay for that coverage. Okay, and then again, like I said, we will leave plenty of time at the end for questions and answers. One thing that I did want to mention as well is that this presentation is posted online at our website, so if you want to have the entire presentation, that will be available for you. So in 2016, retirees' supplemental coverage will be changing. Okay, what is staying the same is that Medicare Part A and B will remain your primary coverage, like it is today. So in 2016, Medicare Part A and B will be your primary. Your supplemental coverage you will purchase through the Aon Retiree Health Exchange. Okay, and then the USG, you will get your retiree benefit from USG will be in the form of a contribution, a deposit of funds into a health reimbursement account. Okay, so you will still have this supplemental coverage like you do today, that supplemental insurance, only that supplemental insurance will be through the Aon Retiree Health Exchange. And then USG will give you funding in order to use towards the premiums for that coverage. Okay? What is not changing, and we touched on this earlier in the April meetings, is the dental and your vision and your life insurance. So those benefits, if you're enrolled in those benefits through USG, those benefits are not changing. And if you don't do anything, those benefits will roll over into 2016, okay? And you will continue to pay for those benefits the same way that you pay for them today, okay? Through the ADP direct billing that they will debit to your account. That will continue. To receive the money into the HRA, the retiree and their dependent must be enrolled in Medicare Part A and B. Okay? The retiree and dependent also must be enrolled in the USG plan for 2015. So just like we have today, we've got rules in place in which if at any time in retirement, if you drop your coverage through USG, you cannot pick up that coverage at a later date. Okay, that rule is remaining the same. So if you do not have the coverage today, you are not going to be able to pick up that coverage and receive the HRA contribution in 2016. Retirees also must purchase their coverage through the Aon Retiree Health Exchange in order to get the HRA contribution from USG. Regarding coverage in the exchange, one of the decisions that we made over the summer, and this is as we were looking at premiums in the exchange, is that we decided that only retirees that are 65 and older will be moving to the Aon Retiree Exchange. Okay? Any retirees that are under the age of 65, even though they're Medicare eligible, they will remain in the USG plan. And we have a very smaller group of retirees that, because they qualified for disability, they're eligible for Medicare and they're under age 65. The reason that we decided to keep them in the USG plan is because when we looked at the premiums on the exchange, they were very high for that group. Okay, so we wanted to make sure we were going to protect those retirees. They will remain in the USG plan until they turn age 65, and then at that time, they will move into the purchasing coverage on the exchange. For spouses, if your spouse is Medicare eligible, they will move to the exchange and receive the HRA funding. If your spouse is under age 65, they will stay in the USG plan. So we know that sometimes we have retirees, or the spouse may be younger, the retiree is older, and we also know vice versa that we may have some retirees that are younger and the spouse is older. So if the retiree is younger, under the age of 65, they will remain in the USG plan, And that spouse, if they're over the age of 65, they will get their coverage through the Aon Retiree Health Exchange. Okay. One of the other questions that we've been receiving, I know some retirees may have a dependent child that they're still covering in the plan. They're under the age of 26. So if you have a dependent child, they will be able to remain in the USG plan. And we've set up separate rates just to address a child-only coverage or a spouse-only coverage in the USG plan. So we have those rates. The GSU HR office will get those rates to you, so you have those. Okay? And the retiree must be enrolled in the coverage for the spouse to be enrolled in the coverage. And that's the same rule that we have today, so that's not changing. Just to give you an example, let's say that the retiree is over the age of 65 and they decide not to get their coverage on the exchange. That means that their spouse would not be able to remain in the coverage. Okay, that's same rule that we have today. Just wanted to make sure we went through that. Okay, last week the Board of Regents approved the funding for the health reimbursement account, and the amount that was approved was $2,736. Okay, that's an annual amount. That's the amount that will be deposited into each retiree's health reimbursement account. Okay, and if you have a spouse, that spouse will also receive the $2,736. Okay, if you break that into a monthly amount, it's $228 per month. And the only reason we have that on the slide, that we broke it into a monthly amount, is just because we think about premiums on a monthly amount. We pay our premiums monthly, and so it's helpful to see what that is on a monthly amount. But you will get that entire amount, the $2,736, will be credited to your account on January 1st. Okay, and you're going to have the flexibility to determine how you're going to be reimbursed throughout the year, and Tammy will touch on that later in the presentation, but the full amount will be available to you January 1st. One of the questions that we've been getting is whether this amount is a fixed amount, okay, and whether it will change year to year. And that is something just like we do today. We will look at the funding every year. And we do the same thing for our active employees. We'll do the same thing for the contribution to the HRA. And we'll look at what's happening on the exchange, what the medical trend is, what medical costs, what the medical costs are increasing. So we'll look at all those factors. We'll also take into account the budget for USG, what our budgetary constraints will be. And every year we'll look at that number and we'll determine whether that number should go up, should it go down, will it stay the same. So we'll look at that every year. The Board of Regents will approve the amount every year, and then we'll communicate it to you. So it's not a fixed amount, okay? Okay, just a couple other things, and then I'm going to give you some examples of premiums on the exchange, so that $2,736 will make a little bit more sense. The funds will roll over from year to year. That's one of the things that as we talked to retirees during the April meetings, we heard that retirees definitely wanted to be able to roll those funds over, and so those funds will roll over from year to year. If you have anything left at the end of the year, it will roll over into the next year. We also wanted to make sure we were as flexible as possible on the reimbursement. And so retirees will be able to reimburse themselves for many different out-of-pocket health care expenses. And so not only will you be able to be reimbursed for your supplemental coverage on the exchange, but if you have money left over, you will also be able to reimburse yourself for out-of-pocket expenses for medical, dental, or vision. So what I mean when I say that, that's like the co-pays, any co-pays that you may have. If you have funds left over, you can get reimbursed for that. Okay, you can also get reimbursed for your Medicare Part B premium, or if you have some of our retirees, they may have some penalties based on their income from Medicare, and retirees can also get reimbursed for those income penalties or any type of late enrollment penalties. So very flexible on that reimbursement. And then one other thing about the HRA account is that if you and your spouse are both enrolling in coverage on the exchange, you will have a joint account. So the 2736 from the retiree and the 2736 from the spouse will be deposited into one joint account. And the reason why that is helpful is because if you have a retiree, let's say you have a retiree and a spouse, they both have coverage, and let's say the retiree is very healthy, and they've got a lower premium and they don't have a lot of out-of-pocket expenses. And let's say that spouse, maybe they take a couple of prescriptions and they need a little extra funds. They can utilize some of the funds from the retiree that the retiree is not using. So that's helpful that those funds go into a joint account, and either the spouse or the retiree, whoever may need some extra funds, can utilize those funds. Okay? So the next couple of slides are, we're going to talk for a few minutes about numbers, just to give you an idea of what kind of premiums you can expect to see in 2016 on the exchange. And when we're talking about the plans, I'm going to go very high level about the two different plan options, and then Tammy's going to go much more into detail about what these plans mean and comparing the two plans. But just for purposes of the numbers, you're going to have a choice of two different plan options. One is a supplemental plan, also called a Medigap plan, and this supplements the coverage to Medicare. And for the highest level of coverage, and this is where the retiree would not pay anything out of pocket on their medical, the premiums on the exchange for 2015 range somewhere between $150 a month to $250 a month. That's per individual. If you enroll in a Medigap plan, you also will need to enroll in a Part D plan, which is the prescription drug coverage, because the Medigap plans do not include that. And the average premium for a prescription drug Medicare Part D plan is around $35 a month. So just to give you an idea of what those premiums are today. Okay. The other choice you're going to have is a Medicare Advantage plan. Okay, and remember, Tammy's going to talk about what these plans are. But just to give you an idea, the premiums for a Medicare Advantage plan, they can range anywhere from $0 to $100. So there's some plans that have a $0 premium. Okay. So just in summary, Medicare Advantage today, they have premiums that range anywhere from $0 to $100. But again, those plans, the premiums are lower, and you might have a little bit more out of pocket when you go to the doctor. Okay, and then if you go to the Medigap, you have a Medigap plus a Part D plan. You would have to enroll in that Part D, and your premiums could range anywhere from $185 to $285 a month. Okay, so compare that to what USG is going to deposit into the HRA, which is about $228 a month. So that can give you an idea that some of our retirees are going to enroll in coverage, and that monthly premium that they pay, the reimbursement from USG is going to cover that entire premium. And they may have some funds left over to utilize towards out-of-pocket expenses. But that decision is going to be up to you. You're going to be able to decide what plan you want to enroll in. And remember, today, for a single retiree is paying $116 a month. Okay? There were really two goals that the USG had when we were determining what the amount was going to be when, for the retirees, what that deposit was going to be to the HRA. And those two goals were, number one, we wanted to make sure that retirees were not going to, that their premium was the same or less in 2016 than it is today. Okay, so that was one of our goals. The second goal was that USG was not going to pay any more for Medicare-eligible retiree health care in 2016 than we do today. And we really think with this amount that we're going to be able to meet those two goals. Okay, when you think about putting that $228 that you're getting from USG with the 116, and that's what the premium is that you pay today, that's $344 a month. I think that math is right. Somebody tell me if I'm wrong. So just think about that's the amount that you're going to have in premium dollars for 2016. Okay. And just a couple other important notes. Just remember, if you do not enroll in coverage in 2016 on the exchange, you're not going to be able to have the opportunity to enroll at a later date. So it's really important that you understand, in order to continue your retiree benefit through USG, you have to have that continuous coverage, and that coverage will be through the Aon Retiree Exchange for 2016. And again, just to remind you, if you've got a spouse or dependent that is under the age of 65, they will remain in the USG plan until they turn age 65 or your dependent ages out. And then at that time, they will move into the Aon Retiree Exchange. And Aon will notify that spouse within 3 months before their 65th birthday, and make sure that they have the opportunity to go through the enrollment process and get all the information they need to make that important decision. Okay? At this time, I'm going to turn it over to Tammy, and she's going to talk about the Aon Retiree Exchange. Tammy?
Thank you, Karen. Good morning, everybody. My name's Tammy Hartzworm, and I'm with Aon Retiree Health Exchange. It's my pleasure to be here today to speak with all of you. My main goal today is to make sure you leave this presentation with a better understanding of what's going to take place over the next few months and how Aon Retiree Health Exchange is going to be able to assist you through this entire process. I've been in the Medicare industry for the past 5 years, and I actually started as a benefits advisor, and I have educated and enrolled hundreds of retirees just like yourselves and helped them through this process. So I'm very familiar with your questions, the plans that are available to you, and we're going to be here to make sure that there is a soft landing for each and every one of you. What I'd like to start out talking about today is what is a private exchange. A private exchange will provide you with more options offered by more insurance companies than what the current USG retiree plan could offer. You'll be able to compare your carriers, prices, and select health insurance that meets your individual needs. Policies will be offered by companies that you'll recognize, like United Healthcare, Humana, Blue Cross and Blue Shield, just to name a few. We represent over 90 major insurance companies throughout the United States, and they are the A++ carriers. They're the big guys. They're the ones that have the staying power in the industry to help their retirees with their individual health care needs. Now, the USG traditional plan offered limited choices with only one carrier based on a specific benefit design and pricing structure. Moving forward, you'll have an option to choose from many different insurance carriers and benefit structure and build a plan that you need for your individual situations. Now, the Aon Retiree Health Exchange is one of the nation's most trusted advisors in navigating Medicare, and we have a reputation for providing outstanding assistance to Medicare recipients. We realize that a change like this is complex and can feel very overwhelming for some individuals. And it's important to USG to ensure their retirees would have a strong level of assistance and support to guide them through this process. We offer a broad range of health plans to choose from, and we also offer robust tools to help you learn, prepare, and enroll into your new coverage. Also, the National Council on Aging recommends the Aon Retiree Health Exchange because we meet or exceed NCOA's standard of excellence for Medicare brokerage services. Now, in September, you will receive an education kit in the mail. And this is going to include a letter, and on that letter is a date and time for your scheduled appointment with your benefit advisor. We ask for a little help from you. We do require you to call in to confirm that appointment with the benefit advisor. If that time and date won't work for you, let us know and we can change that appointment time for you. Some of you may be vacationing. We've had a lot of questions where individuals are going to be out of the country or out of the state for the month of September, and we're wondering how they'll confirm their appointment. If you're going to be gone and you haven't received that education packet before you've left, we have our phone number in the handout that you have with you. It will be up on the screen at the end of the presentation. And please feel free to call us and we'll be able to confirm that appointment before you leave on vacation. Now, when you're confirming that appointment, we also want to make sure that you are comfortable and have someone available, if you wish, to also accompany you on that phone call. You could have a son or daughter on the phone. Maybe you would like a friend to sit in and listen. I mean, another set of ears is always nice to have when you're making a decision like this. When you call our service center to confirm your appointment, you're speaking with our benefits support staff, not the benefit advisors at that time. So just let them know who you want on the call, give them the phone number, and they'll notate that in your account, and the benefit advisor will conference them in on the day of your appointment. If you don't make that decision before you confirm your appointment, and at the end, right before your appointment, you decide you want somebody with you, that's okay. Just when the benefit advisor contacts you, just let them know that you'd like to conference somebody in to listen, and it doesn't matter where they are in the country. We'll make sure to conference them in, and they'll be on the phone with you and help you through the process. Now, some of you may be a power of attorney for the other or for another individual. A power of attorney can also take care of choosing the plan and enrolling an individual into the coverage. If you are a power of attorney, just let the benefit advisor know. Aon Retiree Health Exchange does not expect you to send in the documentation of your power of attorney, but keep it handy because once you enroll an individual into a plan, the Centers for Medicare and Medicaid Services, known as CMS, or the carrier could ask for that documentation and they'd like you to fax it in or mail it into them. So just have it handy. Now also, along with that kit that you're going to receive in September, you'll also receive a Basics of Medicare guide. And that's going to tell you what you're going to need to have handy for your appointment with your benefit advisor. We ask that you have your Medicare card handy. That's your red, white, and blue Medicare card. The benefit advisor is going to need to know your Part A and Part B effective dates as well as your Medicare number when it's time to enroll. We'll also ask that you have a list of your doctors and hospitals available. Some of the plans that you can choose to enroll in are network-based plans. And we will take the time to ensure that your doctor is in the network of the plan that you choose before you enroll in that plan. We don't expect you to change your doctors. The doctors today that you have, you've probably had for a long time. You have a good relationship with them. Those are the doctors you want to keep. We'll let you know if the plan that you've chosen has your doctor in the network. If not, we'll help you choose another plan. But it's your decision if you would rather keep your doctor or change that doctor. We also ask that you have a list of your prescription drugs, the frequency that you take, and the dosage. The reason why we ask this is there's hundreds of prescription plans out there today. Today, you're on one plan that you're all covered on. Now, you all don't take the same medications. Moving forward, you'll choose an individual plan based on the medications that you take today. And we'll ensure that those prescription drugs are covered under the formulary and let you know what plan has the lowest estimated out-of-pocket cost for you. So by having that list of your prescriptions in the discussion with your benefit advisor, we'll find the plan that has the lowest out-of-pocket expense for you. Now, our benefits advisors are located in 4 different areas of the country. Located in Lincolnshire, Illinois, that's where I'm from, Orlando, Florida, Charlotte, North Carolina, and the Woodlands, Texas. And they're licensed, certified, and trained to offer Medicare-related products in the states that they represent. These benefit advisors are salaried employees. They're not paid a commission, which means they have no incentive to steer you to one carrier or one specific plan. That choice is yours to make. Their main goal is to assist you in finding that plan and helping you enroll in that plan and explaining the benefit structure of those plans, and to be there now and in the years to come if you have any questions about your plan or if you want to change that plan. Now, your benefit advisor is, when you have a conversation with them, they are going to call you at the number that you give to them, that we have in your account, and they're going to leave they're going to give you their full name, their phone number, and their extension. Now, their job is to assist the USG population. So if you call at any time and have a question for your benefit advisor after your first appointment, and their line happens to be busy, please leave a message on their voicemail, because they will return your call within a 24-hour period of time, except for weekends and holidays. So keep that in mind. But business hours, they will call you back within a 24-hour period of time, because it's important that we answer the questions that you have and you're comfortable with your coverage. Now, you'll have the same benefit advisor throughout the entire process. And one thing we want to also let you know is, it's important that you have your relationship with your doctor and you trust that individual and you're comfortable with them. Well, we feel the same way about your relationship with your benefit advisor. And if for any reason you're not comfortable with that benefit advisor, please ask for a manager, and we will have another benefit advisor assigned to you. If you're not comfortable asking for their manager, you can call USG, and they will alert our staff at AN Retiree Health Exchange, and we'll make sure you have another individual assigned to you. We feel it's very important that you're comfortable throughout this transition. Also, some of the other tools we have available, we have language lines. So if you want to talk in your own dialect and it's easier to understand, we can make that happen. We also have TTY lines for the hearing impaired. So we'll do everything we can to make sure that you're comfortable during your phone appointments with your benefit advisors. Now, during your appointment with your benefit advisors, as I said, they're going to call the best number that is available to them. And your benefit advisor is going to educate you on the basics of Medicare, along with the different types of plans available to you. Now, your benefit advisor is going to be able to either email or mail out plan summary of benefits to you for the plans that you're interested in. In this way, some of you may decide on that very first call, you know exactly what you want to enroll in, and it may take one phone call. Some of you may like to have the information sent to you, and you may want to have somebody else take a look at it, or you just want a little bit of time to review and make your decision. That's okay. We'll set up another appointment for you so that you have the time to review. But you will have the documentation. Some of you may go online to our website and take a look at the plan options that are out there and know exactly what plan you want to enroll in. That's okay too. We're here to help you in whatever way you need. Now, your first appointment with your benefit advisor will take approximately an hour, so we want to make sure you're comfortable and ready for that conversation. They're going to go through educating you on Medicare, talking about the difference between the Medicare Advantage plan and the Medigap plan. They're going to review plan summaries of benefits for you, and they're actually going to have a conversation with you, because we represent over 90 major insurance companies. They're going to take the information that you're discussing with them and think of a funnel, and they're going to funnel it down to about 3 plans that you're interested in. And those will be the plans that you'll want to decide on and your new coverage. So your benefit advisor will help you with that. And again, remember, if you ever need another appointment, we will make sure that that takes place. Now, the appointments are going to be held between October 1st and December 31st, but most of the appointments will be between, the scheduled appointments will be between October and the end of November. And if you have the need for an additional appointment, your rescheduled appointments could go into December. Just wanted to let you know that's okay. We know the holidays are in there. We can actually enroll you on December 31st, and your coverage will begin on January 1st of 2016. So there's plenty of time to take care of this, and we want to make sure that everybody's comfortable. So next I want to take a closer look at Medicare and the different types of plans you'll have to choose from. So currently you have Medicare Part A and B as your primary coverage and the employer group plan as your secondary coverage. Now starting in 2016, you'll transition off the group plan, but you'll still have Medicare Parts A and B, and this will remain the same as it does today. You'll also still pay your Part B premium, the same way you do today. Starting this fall, you're going to select an individual Medicare plan in addition to your Medicare Parts A and B. Now, this screenshot is in your handout, just to let you know. As Karen said, there are 2 different types of plans you can choose to enroll in. And again, we work with over 90 major insurance companies that offer these plans. So there's plenty of choices out there for you to choose from. And the first of these plans is known as a Medicare Supplement Plan or a Medigap plan. And these type of plans are going to work side by side with Medicare Part A and B. And since Medicare supplement plans only take care of the hospital and doctor care, you would also need to enroll in a standalone prescription drug plan to take care of your prescription needs. The second type of plan is a Medicare Advantage plan. This is known as Part C of Medicare. And these are your network-based plans. These are the plans that I talked about where we will determine if your doctor is in the network prior to you enrolling in these plans. They're the HMO and PPO type plans. So for an example, an HMO is a closed network of doctors and hospitals, and your primary physician will refer you to other doctors or specialists if you need them. And you must stay within that network to get your services taken care of, otherwise your expense at 100%. It's managed care. A PPO type plan is an open network of doctors and hospitals where you can choose to use whichever doctor or hospital you prefer. You can go in and out of the network. If you stay within the network, for an example, you may pay a co-payment to your physician of maybe $20. If you go out of the network, you may have a co-payment of $40. So when you go out of the network, you have a higher out-of-pocket co-payment than if you stayed in the network. But it's your choice. It's not all doctors that you have may be in the network, and then you can decide which doctor you're going to pay a little bit higher to see out of pocket. These plans also work very well if you travel or you have another residence in another state, because you can still have your services taken care of if you wish, but you'll just pay a higher out-of-pocket cost for that out-of-network service. So what I'd like to do now is break down these plans into their various parts, and we're going to start with Medicare Part A and B. We feel it's very important that you understand how Medicare works so that you have a good idea of how the Medicare Advantage and the Medigap plans work. Now, I'm going to go over this in a high level, and your benefit advisor is going to review this with you in detail. So how many of you actually truly understand how Medicare works? I have a few hands out there. I like that. I know it's very complex. Well, that's what we're here for. We're going to let you know how Medicare works and how it's going to work with your plans. And it's really important to make sure that we're there to answer those questions for you. What I'd like to do is start talking about Medicare Part A. So what is Medicare Part A? Medicare Part A is your hospital coverage, your skilled nursing coverage, hospice care, home health care. And for most individuals, as long as they or their spouse work 10 years or 40 quarters and paid into Social Security, Part A is premium free. If you haven't worked, if you or your spouse hasn't worked 10 years or 40 quarters, you may be subject to a Part A premium, and the premium will be decided upon by Social Security. Now, Part A has a deductible. When you go into the let me start over. With Part A deductible, it is not an annual deductible, but it's a reoccurring deductible, and it reoccurs every 60 days. So for an example, if you only have Medicare Part A and B as your insurance and nothing else besides that red, white, and blue Medicare card, if you were admitted into the hospital by a physician and spend the night, you would be responsible for that deductible. Now let's say you're discharged from the hospital and 30 days later you go back into the hospital for whatever reason. You're within that 60-day benefit period, so you would not have to pay another deductible. But the day you're discharged, let's say you go back into the hospital 120 days later. Now you're outside of that deductible or that benefit period, and you would have to pay another deductible at that time. And if you're having a bad year, you could possibly pay that deductible up to five times in 1 year. So there is some out-of-pocket expense by only having Medicare Part A and B. Part B, what does that cover? It's your doctor visits, your preventative care, ambulance services, lab services, things like this. Part B does have a premium, and the majority of you probably have your premium taken out of your Social Security check. If you're not taking Social Security yet, you've made arrangements to pay your Part B premium with Social Security. Now, Part B also has a deductible. That is an annual deductible. Once you've met your deductible, Medicare will pay 80% of the approved cost, and you'd be responsible for the remaining 20%. Sounds like your average plan, right? Unfortunately not. Because that 20% is uncapped, meaning there's no limit to the out-of-pocket expense that you could incur by only having Medicare Parts A and B. Now, some individuals will elect to just take that red, white, and blue Medicare card as their insurance and add a prescription drug plan. That's their choice. But I just want to make sure that you understand the out-of-pocket expenses that you could incur so you can make a well-informed, educated decision on how you're going to manage your health care. Now, and this is why most individuals also choose to enroll in one of two different plans, either the Medicare Advantage plan or the Medigap plan, to help curb those costs that Medicare leaves behind. And what I'd like to do now is break down those plans and talk about the benefit structure of each one of those plans. And let's start with the Medicare Supplement Plan, also known as a Medigap plan. Now, a Medicare Supplement Plan works side by side with your Medicare Parts A and B for any type of hospital or doctor care, as long as it's Medicare approved. You're going to go to the doctor, you're going to hand them your red, white, and blue Medicare card, and you're going to hand them your insurance card, because the doctor is going to bill Medicare first, and then Medicare is going to send the remaining bill to the Medigap plan for payment, depending on which type of benefit structure you decided on that Medigap plan. Medicare supplements do not have prescription drug coverage. So you would also need to enroll into a prescription drug plan to take care of those needs. Medicare supplement plans do not have networks. You can choose to use whichever doctor or hospital you prefer throughout the United States, as long as they accept Medicare. So you can have your services done in another state, if you have a residence in another state, if you're traveling, There's no problem because there are no networks. Now, these are a type of plan that individuals will enroll in if they travel, if they have higher medical costs, because the Medigap plans are the higher level of coverage over the Medicare Advantage. Now, in most states, the Medicare supplement plans are standardized plans. And what that means is each Medicare supplement plan must offer the same benefit structure no matter which carrier is offering that coverage. Now, Medicare supplement plans are offered through the letters A through N, and each lettered plan corresponds to a specific benefit structure. And the Medicare supplement premiums for the fully loaded plan tend to be higher than a Medicare Advantage plan. Now, the fully loaded plan is the Medigap F plan, and the F plan, all you'll do is pay a premium, and no matter how often you go to the doctor, how often you go to the hospital, all you're going to do is pay that monthly premium. No co-payments, no co-insurance, no deductibles. Now, when you choose a plan, the carrier is going to determine the premium based on your age, gender, location, and tobacco usage. So, depending on the carrier, a retiree and a spouse, if they enroll in the exact same plan with the exact same carrier, may pay the same premium, or they could pay a different premium because of gender. Maybe your friend lives across the street and is enrolled in the same plan as you are with the same carrier, but that friend across the street uses tobacco products. They may have a different premium than you. So it's very important to talk to your benefit advisor about what type of plan you're looking for. And because these plans are standardized plans, an F plan is an F plan no matter what carrier you choose to go with. The premium is the only difference. And what we like to tell people is choose a plan based on the lowest possible premium, because why pay more for your coverage if it's the exact same coverage? But we also have retirees that may choose to pay a higher premium because they've been established with the carrier for many, many years, and that's the carrier they want to enroll with. That's okay too. It's your decision what you want to pay for that coverage. Now, this is a chart of the supplement plans, and this is also in your handout. And I'd also like to tell you that when you receive your education kit, this will be in the kit. So when you look through the kit, make sure you keep this handy, because when you have your appointment with the benefit advisor, they'll refer to this chart, and this way you can use your education kit and have this chart in front of you when they're talking about the different plans. Now, at the top of the chart are the plans lettered A through N. On the left-hand side are the hospital and doctor benefits that aren't covered by Medicare. In the middle, you're going to see the check marks under each lettered plan. The check mark is going to indicate that that specific plan is covering that specific benefit. So if you look at the Plan F, it has the check marks all the way down. That's the highest level of coverage you could possibly enroll in. Now, if you choose a different plan, they're going to have a lower premium than Plan F. So let's say you decide on an N. What does that mean then? You'll see there's a couple boxes that don't have check marks, right? So for example, if you choose a Plan N, you're going to pay that Part B deductible. Okay? You're also going to pay the Part B excess charge. What an excess charge is if you go to a doctor or hospital that doesn't accept Medicare's assignment, meaning the payment structure of Medicare, they can bill you 15% over and above what Medicare normally charges, and you'd be responsible for that payment. If you decide you're okay with that, you can enroll into this plan, and the premium will be lower than the Plan F. Now, also with a Plan N, which isn't notated here, you'll have a $20 copayment when you visit a physician in their office, or possibly a $50 copayment for using an emergency room. But you have many different options on plans and a variety of premiums that you'll be able to pay. So your benefit advisor can talk to you about these Medigap plans in detail and help you understand what plan may work best for you. Guaranteed issue of coverage. So because you're transitioning out of your group plan, you qualify for guaranteed issue into most of the Medicare supplement plans without them looking at past health history. And this means that the insurance carrier must accept you without you answering any of the health-related questions on the application. Now, this window of opportunity only lasts a few months. So if you wait to enroll after December 31st or change your plan later on, you will not have guaranteed issue, and you would have to answer those questions on the application. And depending upon how you answer those questions, the carrier will determine if they're going to accept you into the plan and at what premium they're going to charge you. So guaranteed issue is not applicable with Medicare Advantage plans or prescription drug plans. The only question that you'll get on the application for a Medicare Advantage plan is, do you have end-stage renal disease? And what that is, it's ESRD, it's considered kidney failure. And if you do have ESRD, you would not be able to enroll into a Medicare Advantage plan because the treatment of it is so expensive. The Medigap plan actually covers it much better. Now, if you're under age 65 and disabled and Medicare eligible, you will also have a guaranteed issue period to enroll in any of these plans once you turn 65. Medicare Part D. This is a great time to talk about Medicare Part D because, as I said earlier, Medigap plans do not have Part D prescription drug coverage built within. Now, Part D is also known as prescription drug coverage, and you can purchase a Part D prescription drug plan as a standalone plan with just Medicare Part A and B. You can also decide to purchase the coverage as a standalone plan with your Medigap plan, or you may choose to purchase it in a Medicare Advantage plan that has the prescription drug coverage built directly within the plan. Now, not all Medicare Advantage plans cover prescription drugs, so make sure that you ask your benefit advisor about the plan that you're interested in and if it does have the prescription drug coverage built in. All carriers are required to, for Medicare Advantage plans, have at least 2 plans that do not cover prescription drugs, but all the rest of the plans they offer will. So make sure you have that discussion with your benefit advisor to ensure that you do have the proper prescription drug coverage. Now, this is also in your handout. The Part D drug plans were first implemented in 2006 along with the donut hole. And each year since 2006, the donut hole has been slowly closing, which is a good thing financially for you. And by the year 2020, the donut hole will be fully closed. Now, all Part D plans and Medicare Advantage prescription drug plans work under the same basic structure, which is shown here on this chart. And with Part D plans, you may pay a higher out-of-pocket cost depending upon your drug needs during the donut hole. Now, most retirees will never reach the donut hole, but for those that do, the donut hole will come into play. And it's very important to have this conversation with your benefit advisor because, like I said, most individuals will never reach the donut hole. It depends on the prescriptions that you're taking and the expense of those prescriptions. So when you have that conversation with your benefit advisor, this is why your benefit advisor is going to look for a plan that has the lowest estimated out-of-pocket costs for your prescriptions and that they're all covered under the pharmacy. Now, also what I'd like to let you know is we also have to be our own advocate when we're talking about our prescription drugs. I don't know how many of you have ever gone to the pharmacy and asked them, how much is my prescription going to cost if I don't use my insurance? Because for generic drugs, if you're taking any of those, sometimes you can go to certain pharmacies and pay $4 for that prescription without your insurance, and with your insurance, you may be paying $10 or $20. So it's worth asking, right? We don't want to pay any more for it than we have to. Also, you know, we like to make sure that individuals know, have the conversation with your physician. If you're on brand name drugs, A lot of times you could be taking generic drugs, but that's a conversation you want to have with your physician. Because if you take a generic drug or an alternative drug, those costs are much lower than the brand name drugs. And you don't know how they're going to work for you. And sometimes it's worthwhile to try them to have that lower out-of-pocket expense. But again, this is a conversation that you want to have with your physician. Be your own advocate and ask those questions. Now, we also want to remind everybody too, with your prescription drugs, with your prescription drug plans, if your doctor, I'll go back to that slide, if your doctor prescribes other medications after you've enrolled into your plan, please call your benefit advisor, because this way we can tell you how that drug that was added is going to be covered under your plan and at what cost. Your benefit advisor can also tell you, you know what, there's a plan that's going to cover that drug better next year and the rest of yours. And you can change that drug plan each year if it's necessary so that you're not paying more out-of-pocket costs. So if you add prescriptions during the year, call your benefit advisor so we can tell you how that drug is covered under your new plan. Okay, let's talk about Medicare Part C. These are your Medicare Advantage plans. Now, as I said earlier, Medicare Advantage plans are the network-based plans. These are your HMO and PPO type plans, open network, closed network of doctors and hospitals. With Medicare Advantage plans, you typically have co-payments and co-insurance when you use the plans. If you go to the doctor, you'll have a co-payment or co-insurance. If you go into the hospital, you'll have a co-payment. If you have X-rays or lab services, you'll have co-payments, similar to what your plan is today. Now, some of the Medicare Advantage plans will also have vision, hearing, dental, health and wellness programs such as Silver Sneakers or gym memberships to the YMCA. The vision and dental is not comprehensive. So if you're looking for a plan that has more comprehensive coverage, we do work with a few carriers that offer comprehensive coverage. Some of you may already have the dental and vision coverage through USG, and that's okay. You can keep that coverage. Even if you enroll in a Medicare Advantage plan and it has coverage in it, bonus, just a little bit extra coverage, right? But you do not have to leave the USG vision and dental plan just because your Medicare plan may have it built within. Medicare Advantage plans also include prescription drug coverage, as I said. Most plans do. And the Medicare Advantage plans have an out-of-pocket max. Now, an out-of-pocket max is like your safety net. It's the most you could spend in any given year on co-payments, co-insurance, and deductibles before your plan will start paying at 100%. So I want to let you, that's a lot of information on both of those plans. Your benefit advisor will go through these in detail with you. So if there's any confusion on any of those, write your questions down, and your benefit advisor will spend much more time on that than I did. But at this time, let's just compare the two plans, and maybe you might have a better idea of what type of plan you're going to be interested in talking to your benefit advisor about. Because choosing either a Medicare Supplement or a Medicare Advantage plan is one of your more critical decisions in this process and should really be a focus going forward. And I think it's an extremely personal decision, financially and medically, what type of plan you're going to enroll in. Now let's take a look. Let's just recap Medigap, known as a Medicare Supplement plan. We typically refer to these as Pay Now because you're paying a higher premium with little to no expense on the back end. And for 2015, the average premium for a Medigap plan, the Medigap F plan, the highest level, was in a range of $150 to $250 per month per individual. Now, there are no networks. You can choose to use whichever doctor or hospital you prefer throughout the United States as long as they accept Medicare. They do not cover prescription drug coverage, so you will also want to enroll into a prescription drug plan to take care of your prescription needs. They do have some foreign travel emergency coverage, 60 days per trip, and a lifetime coverage of $50,000. And there is guaranteed issue into the plans when you're turning 65. By contrast, the Medicare Advantage plans, we typically refer to those as pay later because you're going to have a low to no monthly premium. The average 2015 premium ranged between $0 to $100. And yes, there are zero premium plans out there. You're probably wondering, how can I have a plan that costs me nothing? Well, you're paying into Part B, right? Medicare is subsidizing these plans to keep their premiums low. And these plans are administering your Medicare Part A and B. That's why these premiums are far lower. And these, even the zero premium plans, are excellent plans. You'll just probably pay a little bit higher co-payments and co-insurance, but you have options on what your premiums are going to be. Again, network-based HMO, PPO type plans. Most include prescription drug coverage. There will be probably 2 plans with every carrier that do not have prescriptions built within. Co-payments, co-insurance when you use the plan. If you don't use the plan, all you're paying is that premium till you go to the doctor or hospital, and that's when you'll have a co-payment or co-insurance. Let's see what else. Guaranteed issue into these. Guaranteed issue is not applicable. You can always enroll into a Medicare Advantage plan as long as you don't have end-stage renal disease. And also what I want to do is just to remind you that only the individuals who are 65 and older will be transitioning through the Aon Retiree Health Exchange into the Medicare plans. Anyone who is under the age of 65 will remain on the USG plan until they age in to Medicare and turn 65. So hopefully this gives you a better idea of the 2 types of plans that are out there and starts you thinking about what you're looking for in coverage. And your benefit advisor will then go through these plans in detail and the summary of benefits with as well. So when you have your appointment with your benefit advisor, they're going to go through those plans. You'll probably make a decision on which plan you want to enroll in. So let's talk about the enrollment process and what that's going to look like. And now's the time to really start thinking about your insurance coverage in an individual way, because for many years, the retiree, spouse, and dependents have been on a group plan, a family plan, right? Well, moving forward, if there's an individual who is 65, they will transition through Aon Retiree Health Exchange into the Medicare plans. And a spouse who is 65 will do the same. Now, you can choose the exact same plan with the exact same carrier. Maybe you both enroll into a Medigap plan with the same carrier. Or maybe you both enroll in a Medigap plan, but you have 2 different carriers. That's okay, because you're going to have 2 separate premiums and 2 separate policies, individual policies. There are no more family plans with Medicare plans. One of you may have higher out-of-pocket costs due to medical reasons. So you might decide to enroll in a Medigap plan and have low out-of-pocket expenses and just pay that premium. Where the other one might decide, I'm really healthy. I don't go to the doctor but once a year just for a physical. So maybe you want to choose a Medicare Advantage plan. Whatever or however you choose your plan is your personal decision. And I will say most of us don't take the same medications that our spouse does. So you could be on a separate prescription drug plan as well. Or you may be on the same plan. We do have retirees, just because they like the convenience of knowing that they're on the same plan, you can do that. It's your choice. And your benefit advisor will help you find those plans. Now, these are the enrollment periods. You are in a special enrollment period known as a special election period, and that special enrollment period runs from October 1st through December 31st of this year. If you are happy with the plan that you're enrolled in and you pay your premium each month, that plan is going to roll over year after year after year. You do not have to re-enroll in these plans every year. If you're happy with it and you pay your premium, it'll keep rolling over. But if you're someone who decides, I want to take a look at other plans that are out there, You can change your plans during the open enrollment period, which is October 15th through December 7th of every single year. And Aon Retiree Health Exchange will send you out a reminder card that the open enrollment period is upon us. You'll see it on TV as well. I know there's a lot of commercials out there. But this way, if you're interested, you can call in. We'll set up an appointment with your benefit advisor, and you can speak to them about different plan options to see if you still want to stay in the same plan. We do suggest, like I said earlier, if you've added prescription drugs, you probably will want to call your benefit advisor and take a look at the prescription drug plans that might be available the following year, and if they cover your added prescriptions any differently, because you don't want to pay any more than you have to for those prescription drugs. Now, if you are an individual who is not 65 yet, when you turn 65, you will also have your own enrollment period known as the initial enrollment period. And this is where you can enroll 3 months before, the month of, and 3 months after with guaranteed issue into these plans. Also, for those of you who may have TRICARE or VA coverage, first of all, I'd like to say thank you for your service to our country. And secondly, let your benefit advisor know that you have this coverage, because we recommend that you have a conversation with your VA or TRICARE representative so that you understand how the coordination works between those TRICARE and VA coverage and Medicare. Medicare normally pays first and the VA coverage pays second, or the TRICARE pays second, but there are some nuances on the mail order pharmacy requirements with TRICARE. So we do encourage you to speak with your representatives and let your benefit advisor know that you have that coverage. So let's talk about how you can enroll into these plans. Now, when you receive your education kit in the mail, it will have our web address, and you are very welcome to go online and take a look at the plans that are available. Now, when you go online in September on our website, that is only going to have the 2015 plans. We do not have the 2016 plans loaded up on the website yet, and the reason for that is all of the plans that are offered by all of the carriers that we represent must be approved by CMS, the Center for Medicare and Medicaid Services. And they do this every single year. So once they approve those plans, then they'll send us the information and we're able to load it up on our website. And the 2016 plans that you're going to be enrolling in will be available in October. But to give you an idea of how these plans look, what the benefit structure is, what the premiums are, you can go online once you receive your education kit and take a look at it. Because the plans are not going to change much and the premiums aren't going to change much. But it's going to give you a pretty good idea of what kind of coverage is out there and the options that you have. And we do recommend that you go out and visit the site to give yourselves an idea. Now, some of you may know exactly what you want to enroll in after you've received your education kit and you've gone online. And after October, you can actually go online to our website and enroll yourself into the coverage of your choice, up to voice signature requirements. It will prompt you to call us so that we can record your voice signature, send it to the carrier, and they'll process the application and send you out your new cards. For those of you that want a little bit more hands-on, you'll have your appointment with your benefit advisor. When you decide on the plan and are ready to enroll, we do that telephonically. The application is a scripted application between you and the benefit advisor, and the script has been approved by CMS. They have to approve these application scripts, and they will take the information, question and answer that you're having to fill out this application right over the phone. And at the end, your voice signature and acknowledgement that you want to enroll in this plan will enroll you into that plan. We take that information, we send it off to the carrier, they do the processing, and then January 1st of 2016, your new coverage begins and you'll have your cards. Now, about 0.5% of the carriers that we work with may require a wet signature on their application. If you, by chance, choose a carrier that requires a wet signature, your benefit advisor will fill out the majority of that application for you. They'll mail it out to you. All you're going to have to do is sign and date it, put it back in the self-addressed stamped envelope, and mail it back to us, and we'll take care of processing. Some of these applications, I don't know if you've ever seen them, but they could be 20 pages long, and they're daunting. And they don't even, most carriers don't do applications anymore that you have to have a wet signature on it, because they need to ensure that the questions are answered properly and every area is filled out properly, so that there's no delay in your insurance starting on January 1st of 2016. So we take care of all that for you. You don't have to worry about it. You choose your plan, we'll take care of enrolling you. How are you going to pay for your coverage? Let's talk about that. You really have 3 different ways to pay for your coverage. Some of you may decide that you're going to take the traditional route and write a check, send it in with a coupon book each month. That's okay. That's one of your options. You can also choose an option of having your premium payment directly taken from your checking or savings account, which will go directly to the carrier. This is the most common way of paying your premium. You can go on with life, enjoy your retirement, travel, and you know that your premium is paid each month. The third option, and that is only for the Medicare Advantage plans and prescription drug premiums, because those plan premiums are far lower, you can actually have those premiums deducted from your Social Security check if you wish. Now, you can also pay your premiums the way you want to pay them. You could pay them monthly, quarterly, semi-annually, or annually. So keep that in mind too. I know a lot of individuals like to pay in advance and then they don't have to worry about it. You also have that option as well. Just let your benefit advisor know, and when they take you through the enrollment process, they'll make sure that it's filled out properly. Now, your health reimbursement account, known as your HRA. As Karen said earlier, any remaining balance in your HRA at the end of the year will roll over to the following year. And in addition, USG is providing a catastrophic HRA, which is a special account that can be used in the situations where an individual may reach the catastrophic level of coverage under the Medicare Part D design. And this is the point after meeting the donut hole where the individual will start to pay 5% of the covered prescription drug cost in that year. Now, this special account can be used only for these prescription drugs. And in 2016, USG will cover the full amount of any expense you incur in the catastrophic phase of coverage. Now, except for the catastrophic HRA, the accounts are joint. Your HRA is a joint account, one bucket of money, which both you, the retiree, and spouse can use to be reimbursed for your premiums and out-of-pocket expenses. One of you may have higher out-of-pocket expenses or a higher premium where the other one doesn't. And you're able to use that account. And we'd like to tell you that reimbursement account is there for you to use. Use it. You can have your Part B premium reimbursed. At the end of the year, what we like to tell you to do is your premiums are probably going to be the highest expense. Most individuals will have their premiums reimbursed first. But if you have out-of-pocket expenses, save all those receipts. And then at the end of the year, or maybe halfway through the year, however you want to do it, send that in with a claim form and you'll be reimbursed for those out-of-pocket expenses as long as there's money left in your account. Once your account is depleted, there will be no more reimbursement until the next year starts up again. Okay? So let's take a look at this and really go through how this HRA is going to work. And this is actually in your handout as well. And your benefit advisor will spend as much time on this section as possible. So if you have any questions after you leave today, make sure you write them down so you can have these discussions with your benefit advisor. They'll be able to spend much more time with you. So USG is going to establish the HRA on your behalf. You're going to pay for your premiums and out-of-pocket expenses, such as co-payments and co-insurance, and then you're going to be reimbursed. Now, since the HRA is a tax-free account, you don't pay tax on the amount USG credits or any reimbursements that you receive. We've had questions at other meetings that said, why can't you just take that money and deposit it into my checking and savings account and I can use it the way I want to for my medical? Well, the reason for that is you would now pay taxes on that money. A reimbursement, a health reimbursement account is set up to be reimbursed so that you do not have to pay tax on the money that USG is providing to you. Now, if you have an account balance left over, it will roll over to the following year. And most companies that we work with offer something called auto reimbursement for premium. And it really makes life really simple. So here's how it's going to work. The first thing you have to remember is you are going to pay your premium directly to the carrier. That carrier is going to alert Aon Retiree Health Exchange that you paid that premium. And we will reimburse you dollar for the premiums that you paid. We'll reimburse you throughout the year until your account is depleted. Or if it's not depleted and you have money left over at the end of the year, it will roll over, or you can use that for out-of-pocket expenses. But what you need to know is you must pay your premium first. The carrier will let us know that you paid your premium, and then we will reimburse you dollar for dollar back into your checking or savings account. Now, some of you may choose a plan that your premiums for your plan and the reimbursement that USG is giving you is not going to cover your entire premium for the year. So instead of having dollar for the premium reimbursed to you, you may choose to have that $228, that 27 and change. They'll divide that by 12, and you can have a little bit of money, the $228, sent out to you each month for budgeting purposes. It's however you want to manage this account and however you manage your finances. So you have two different options on the way you can be reimbursed. Also, let's talk about the timing of the reimbursement. Now, your plan will begin January 1st of 2016. Your HRA account will be set up January 1st of 2016. Now, your first reimbursement could take up to 60 days to receive. It won't necessarily take that long, but it could. And the reason for this delay is because the carrier and Aon, we need to substantiate that payment. It's a check and balance. It's an audit. We need to make sure that everything is the way it's supposed to be on that account before we can start releasing the money. Now, if for any reason you couldn't wait a month, 2 months, or up to 60 days to receive that first premium payment, call your benefit advisor. Your benefit advisor will be able to talk to you about a premium auto reimbursement claim form that you could fill out one time with the proof of the payment, and that will start the process a little bit faster. So there is a way to speed up the process. We want to let you know that. So in the event you can't wait that long to get that first reimbursement, contact your benefit advisor and we'll speed that up for you. Now, once you receive your first reimbursement, each month after that, you will receive your reimbursements no later than the 6th of every month. So for budgeting purposes, you're going to know by the 6th of every month, I'm going to receive that HRA reimbursement. Now, it could take longer or quicker depending on how you decide to have your reimbursement sent. If you want us to send your reimbursement and by a check in the mail, 7 to 14 days postal service. Or we can deposit it right back into your checking or savings account. It takes 2 days to do. So it's your choice how you want to be reimbursed. Just let your benefit advisor know, and we'll make sure that we set it up. If we don't hear from you, the first reimbursement will go out by check, but you can always change that option on how you're reimbursed, okay? And again, your benefit advisor will go through this in detail with you during their appointment. Now let's take a look at the tools that you have available to you now and moving forward. One of the great things about enrolling in the plans through the Aon Retiree Health Exchange is that we offer advocacy support to assist you even after the enrollment. And in the event you have any issues with access to care, billing disputes, claim denials, authorization issues, you can contact the advocacy department and they'll go to bat for you. This department, it works miracles. They're wonderful. Keep in mind, if you ever have any billing or claim disputes and you've already talked to your provider, you've talked to your carrier, and you're still not getting anywhere, call your benefit advisor. You have their number, and they will get you in touch with the advocacy department, and the advocacy department will step in and take over the filing and the phone calls for you, so you don't have to. Now, our advocacy group has been around since 1999. They work with over 400 clients, and on average have 18 years experience between all of them, and they really do a great job. And I did bring with me today 3 examples of how our advocacy service has helped our retirees in the past, and I thought I'd share those with you today. Our first example, the retiree received an unexpected bill from their rheumatologist, and the provider miscoded the diagnosis and CPT code. This is probably the most common thing, and I think it's probably happened to everyone in the room, right? Well, as a result, the charges were not eligible for Medicare. So our advocacy department worked with the provider and corrected and reprocessed the bill. And after the bill was reprocessed, our advocacy department communicated the correct liability to the retiree so that they could make a payment. Our second example, Medicare denied the claim, indicating that Medicare was not the primary payer, and the retiree did in fact have additional coverage, and Medicare was the primary payer. This individual enrolled into a Medigap plan, and with a Medigap plan, Medicare pays first, Medigap plan pays second. So our advocacy department facilitated refiling the claim with Medicare, and then forwarded the evidence of benefits to the health plan for the secondary payment. In our third example, we had a retiree who was denied access to a wheelchair. Medicare denied their claim as not being medically necessary. And so our advocacy department got involved, and they worked with the provider and collected all of the medical records and forwarded off to Medicare. And once Medicare approved the wheelchair, our advocacy department went one step further, and they had that wheelchair delivered to that retiree's home, so they didn't have to go out and pick it up. So our advocacy department is there if you need them. Please do not hesitate to call. That service is there for you to use. So if you need us, please call. We're there to help. We also have a website for you. Now, once you receive your education kit in the mail, you'll be able to access our website. On the website, you will be able to confirm your appointment, change your appointment, make sure that your phone number and address are correct. You can add your prescriptions to the medicine cabinet so that when you have your appointment with a benefit advisor, they can take a look at your prescriptions and they'll review those with you to make sure that they're correct. You can also compare up to 3 plans at a time and add them to the shopping cart. By adding them to the shopping cart, the benefit advisor will know exactly what you're interested in talking about, or by adding them to the shopping cart, you could actually enroll yourselves into those plans up to signature requirements, but only after October 1st. You cannot do that during September because the 2016 plans will not be available until after October. Also, once you're enrolled in your plans after January 1st, you can go online and manage your HRA account. You can go online and take a look at the balance, find out when the last claim was processed, when a direct deposit has taken place, or maybe you're having a check mailed out to you for the reimbursement, you'll know when that check was sent in the mail. So you'll be able to manage your HRA account from that website. Again, we want to make sure that you understand that you don't have to have a computer to work with us. That's the job of the benefit advisor. So if you don't go online and you don't want to work on the computer, all you need to do is call us. We'll confirm your appointment. We will confirm that your phone number and address is correct. We'll add your prescriptions to the medicine cabinet. You'll be able to work with your advisor to compare the plans that you're interested in. We'll send you out the plan information so that you can review it prior to enrolling. And you can talk to your advisor about the HRA. They can tell you what the balance is. They can tell you when the claims were sent out, when the last direct deposit was made. So just call your benefit advisor if for any reason you don't use a computer. We can still give you all that information. Okay, we're almost done. Let's talk about timeline and next steps. So during August and September, you've received publications from us, and we're going to continue to hold the retiree meetings so that we touch the majority of the USG population and help them understand what to expect over the next few months, and help you decide on a plan. During October and November is when you'll have your scheduled appointment with your benefit advisor, and if you need more than one appointment, it could roll into December. That's okay. Just to let you know, it could go through December as well. Also in December, you're going to receive another publication in the mail, and that's going to come from your spending account. We call that YSA. And they're another division of Aon Retiree Health Exchange, and they are administering your HRA account. On that letter will be a web address as well as a phone number. This is where you need to either go online or call us to let us know how you want your reimbursement set up. Do you want us to send you a check in the mail, or do you want us to have your reimbursement directly deposited into your checking or savings account? So in December, when you receive this welcome kit, is when you'll let us know how you want to set up that HRA account. And that will have the phone number and web address. And then 2016, your new health care coverage will begin January 1st of 2016. Hello? Okay, just a few more things. We know we've given you a lot of information today, and we know it's a lot, and I hope this has started to help you better understand the plans that are out there today for you to choose from, possibly giving you some ideas of which type of plan you want to enroll in. Just a few things to remember. When you receive your education kit, you must confirm that appointment. We cannot reach out to you until you call and confirm that appointment. That is a CMS requirement, so please take the time to confirm or change that appointment. Again, if you're going out of town, no problem. Give us a call and we'll be able to confirm that appointment early. Have your Medicare card handy. A list of your prescription drugs, a list of your doctors and hospitals. If you're power of attorney for somebody, what we'll do is, have your documentation out. You will not have to send that documentation to Aon Retiree Health Exchange. But once you enroll into a plan, or you enroll the individual into a plan, CMS or the carrier may require you to send that information in, so just have it handy. And then when you receive your education kit, read through it. There's a section in there where you can jot down questions that you may want to ask your benefit advisor during your appointment. You will be enrolling and have your enrollment completed by December 31st of 2015. Our phone number is up on the screen. It's also on the back page of your handout. It will also be in the education kit when you receive it. Remember, we're just a phone call away. Our hours of operation are 9 a.m. to 9 p.m. Eastern Standard Time, Monday through Friday. And remember, if after your first appointment, if you ever have to get a hold of your benefit advisor and they're on the phone, please make sure to leave a message, because they will give you a call back within 24 hours. And at this time, I'd like to ask Karen to come on back up so she can conclude the meeting.
Thank you, Tammy.
I'm just going to grab that real quick.
Oops. All right, I want to thank everybody for coming today. I appreciate your attention. As we went through the information, again, just want to emphasize the resources that you have available between now and October. You do have the Aon retiree line that you could call. We also have information on our website, and this presentation will be on the USG website. So if you want to see the presentation in its entirety, it's on the www.usg.edu/hr/retiree_benefits. I know that's a long one. It's up there. Okay. Okay. Yeah, if you go to, Marion had a good idea. Just if you go to the benefits section, the retiree link is the first link that you see under the benefits section. Okay. What we'll do at this time is we'll go ahead and open it up for questions. Okay, and if you have a question, what you can do, if you jotted it down on the card, you can pass those to the center aisles, and we have students that will be collecting those, and they'll be reading the questions. And we'll take a minute and let those that cannot stay to go ahead and to leave, and then we'll open it up.
This works well because there won't be any interruptions.
Right,
when we have,
right.
I like that.
Right. Yes. Questions, okay.
That's a good.
Okay. Yes, yes, you will. Okay. All right, let's go ahead and start taking questions.
Okay, we're going to
About part.
start with questions. If everyone could take their seats,
Part B.
and we'll take
D?
care of answering the questions that were
Okay,
turned in on the
I will
cards.
need to see you after the meeting, or, yes.
Is this something you need to know?
Yes, we do need to know that.
Okay, so can you keep that and take care of?
Yes, I will give it to the HR office.
Okay.
Yes, okay. Yeah, I'll take care of that. Thank you, sir. I appreciate it, yep. Okay. Why don't we go ahead and start taking the questions? Are they going to read them? I've got, yeah. Okay. We'll have the students go ahead and start reading the questions.
And if they're duplicate, just let us know.
First question. Currently, I also have a Medicaid supplement plan, F. Can I keep it, and how?
Okay, so the question that is upon us is, they have the USG coverage and a Medigap F plan. So that means that you're already out in individual coverage with Medicare. So you're still transitioning off the employer group plan. You will need to enroll into a prescription drug plan through Aon Retiree Health Exchange to be eligible for the HRA, But yes, you could keep that Medigap F plan as long as it's an individual Medigap F plan through the individual coverage and not group coverage.
If Medicare Advantage doesn't work out for you and you decide to switch to a Medigap policy the next year, how difficult is that? I've heard that you might be turned down for Medigap if you have a pre-existing condition.
Very good question. So with most carriers, when you enroll into a Medicare Advantage plan first, and say a couple years afterwards you decide that you need a little bit more coverage and you would like to go to a Medigap plan, you would be required to answer the underwriting questions on the application. Now, depending on how you answer those questions, the carrier will determine if you're eligible for the plan and at what premium. Now, some carriers that are out there have what is known as a, what do you call that? Free peek. So you can take a look at the Medicare Advantage plan and then be able to enroll into a Medigap plan before that first year ends. You'll want to talk to your benefit advisor about that because it's specific carriers that allow that to happen. What I also want to tell you too is if you're in a Medigap plan, let's say you're in a Plan F and you decide you don't need that full coverage and you want to go down in coverage to an N or a C or something like that. You do not have to answer the underwriting questions to move down in coverage on a Medigap plan. But let's say, and there are carriers out there, and this is another one where I'm going to refer you to your benefit advisors, which allow you to go between the A, F, and all of those different lettered plans within that carrier. So talk to your benefit advisor and see if that plan is available to you. If you were in a Plan F and you wanted to change, let's say you're in a Plan F with United Healthcare and you want to change to an F in Blue Cross Blue Shield. At that point, even though it's exactly the same coverage, you're transferring or trying to transfer to a different carrier, and you would have to answer the underwriting questions on the application. So very good question, and have that conversation with your benefit advisor.
What is SilverScript?
SilverScript. SilverScript, or was it Silver Sneakers? SilverScript? Well, SilverScript is a prescription drug plan. SilverScript is what you have today. So if you are age 65 or older, you will be transitioning off the USG plan and you will no longer have the plan you have today or SilverScripts. So you will enroll into new coverage based upon your needs and your prescription needs. Now there are going to be prescription drug plans out there that are going to probably cover your drugs better because of the formularies that are out there. Your benefit advisor is going to be able to help you with that. Yes, if you are on the SilverScript plan and 65 or older, that plan will be going away. The plans that you are enrolled in today, if you're 65 years or older, they will be going away. You're transitioning off those plans, and you're going to re-enroll into Medicare insurance plans in the individual market. Now, you could enroll into a Blue Cross Blue Shield plan in the open market if you wish.
Oh, my goodness. Oh, my
Thank
goodness.
you for joining us.
Okay. All right. Thank you. Thank you.
Thanks for coming.
Thank you.
You're very welcome.
Appreciate it.
Next question.
Okay. Could you explain the benefits for Parkinson's disease?
The benefits for Parkinson's disease? That is plan specific, but the plans, and I know this firsthand because my father had Parkinson's disease. There's a lot of medications you have to take. There's a lot of trips to the doctor. There could be frequent trips to the hospital. It's a lot of expense. It's a lot of out-of-pocket expense. I would say probably a Medigap plan would be your best option because you're going to pay a premium, and no matter how often you go to the doctor or you go to the hospital, all you're going to pay is that monthly premium. You're not going to have co-payments or co-insurance when you go to see your specialists or your doctors or have blood. You'll also go into a prescription drug plan, and your benefit advisor will let you know how those prescriptions are covered and what plan to choose from to make sure that those drugs are covered at the lowest possible cost.
I turned 65 July 2016. When will my coverage begin? July 2016 or January 2017?
So you're aging in, you're turning 65 in July. So you have the initial enrollment period. We can enroll you 3 months before your birth month, the month of, and 3 months after. I suggest you do it 3 months before, because if you enroll 3 months after, you're going to have a lapse in coverage. So your coverage will begin July 1st.
Can you change plans you are enrolled in during the enrollment period?
Depending on, yes, you have specific enrollment periods. Each year, the open enrollment period is October 15th through December 7th of every year. And you can change your Medicare Advantage plan and your prescription drug plans at that time. A Medigap plan works differently. You can actually change those plans any month of the year that you wish. I suggest you call your benefit advisor before you even start thinking about changing your Medigap plan, because the underwriting questions will come into play. But the Medigap plan can be changed each month. Medicare Advantage, prescription drugs, each year during the open enrollment. Now remember, if you like your plan and you continue to make your premium payments, the plan that you enroll in will roll over year after year after year. You do not have to re-enroll.
Explain silver slippers.
Sneakers.
Silver sneakers. Okay, that is that's a program that is out there that it's gym membership, where you may pay a lower cost to join that gym. And some of them are YMCA memberships. They have a list of different fitness facilities that you can join at a reduced price.
Do you have any suggestions on where or how to set up your HRA account?
Okay. To set up your HRA account, I would wait until you receive your YSA welcome kit in the mail, which will be coming in December. Once you receive that, there is a web address and a phone number for you to call. All you need to do is tell us how you want to be reimbursed. Do you want us to send you a check, or do you want us to deposit it into a checking or savings account? That's all you have to do to set up your HRA account, and the HRA account will be available in January.
I have been on phone conversations with providers, Medicare, Social Security, and various HR people. They answer your questions as if they are reading from a script. If you don't understand what they said, they ask for clarification. They just cycle around and answer the same script. If you continue to request clarification, they get snippy and rowdy. How does your phone personnel receive training to be polite?
Very, very good question. Soft skills are the key, right? Customer service. And, you know, we all know how our customer service is in the country. Sometimes we just want to run. But our benefit advisors are trained every single year. They go through an extensive training on our policies, our procedures, our code of conduct, our security policies. They're also retrained on Medicare. They have to go through a training and certification with all of the carriers that are offering these plans, and they have to be appointed with that carrier before they can actually talk to you about a plan. They are monitored. Their phone calls are monitored daily, and they are coached daily. Soft skills are the biggest thing. We need to listen, excuse me, but I'm going to say it, we have to shut up and listen to know what somebody needs, right? And that's what they're trained on. Now, if for any reason you find somebody that doesn't have good customer skills, please ask for their manager. Call the USG office and let us know, because that's something we need to take care of them. But they will be there to help you through the entire process. And if they're not, please let us know because we would need to correct that.
And yes, and definitely, I just want to reemphasize that if for any reason you have any concerns with the customer service you're receiving, any of the information you're receiving, please reach out to the Georgia State HR office. They can reach out to us and we can make sure we take care of that.
What happens if I die? Does my spouse lose coverage?
So, right, that's a great question. One thing that we did not cover. So there are survivorship rules just like we have in place today. So if the retiree predeceases the spouse, then that spouse can continue in the coverage, will continue receiving the contribution into the HRA just like we have today.
What is a donut hole?
Good question. The donut hole is part of a Part D or Medicare Advantage drug plan. There's 4 basic steps to a donut hole. The first step is where you're paying your deductible. The second phase is where you are paying 25% of the drug costs and the carrier or the provider is paying 75% of that cost. So that's your co-payments. When you go to the when you go to the pharmacy to pick up your prescriptions, that's the initial coverage level and that's where you're paying a little bit. When your total out of pocket between the retail with what you're paying reaches $2,760, you fall into the coverage gap or donut hole, at which point you're required to pay a certain percentage of your brand name drugs and generic drugs. And when your out-of-pocket expenses reaches $4,700, then you come out of the coverage gap and you go into the catastrophic phase of coverage. So that is what the donut hole is. It's the point in which the prescription drug plans that you're paying a higher percentage of the copayment than you would at the beginning. Now again, the donut hole is closing on 2020, and this is a very personal subject that you want to have the conversation with your benefit advisor because it's specific to individuals and their prescription needs. Some people may go in the donut hole in January, come right back out in February. Some may go in the middle of the year. Some may go in October and be there through the rest of the year, or December and they're only there a month. But it depends on the prescriptions that you're taking. And your benefit advisor is going to be able to give you better detail on if you're going to be close to the donut hole, if you're even going to be in it. The majority of retirees will never reach the donut hole. So I don't want you to worry about it. Have that conversation with your benefit advisor first.
I have Medical Advantage Plan C. Can I stay with Kaiser?
Could you repeat that again, please?
I have Medical Advantage Plan C. Can I stay with Kaiser?
Okay. Your Kaiser plan is an employer group plan that will be, if you're 65, over 65, that will be ending at the end of the year. For the individuals who are in Kaiser today or living in an area that Kaiser represents, you will be able to enroll into a Kaiser plan.
Can the account be used to pay a penalty with Medicare that I'm already paying?
So the answer is yes, you will be able to do that. If you're paying a penalty, you can be reimbursed for that penalty. One of the questions that we had in an earlier meeting was, how do I get reimbursed for the penalty?
So, a very good question too. So on your Social Security statement that you get one a year, right? It shows you what deductions are taken from your Social Security check. And if you have a Part B penalty or a late enrollment penalty for some reason, it will show up on that Social Security statement. All you need to do is photocopy that statement and send in the copy. Don't send the original, but photocopy it and send it in with a claim form, and we'll make sure that you're reimbursed month after month for that, as long as there are funds in your HRA account.
How do I add a new wife?
First, you got to ask her.
The one time in which you can add, retirees cannot add dependents during open enrollment. That's one of the rules that we've had in place. So the dependents that you have on the plan when you retire, those are the dependents that can remain in the coverage. Now, if you experience a family status change, that is the one time during the year in which you can add a dependent to your coverage. So if you get married, or if your spouse loses coverage, at that time, you can add that dependent to your coverage. Okay.
If we are 65 or older and enrolled in Medicare but are still working, is there anything we need to do now?
Okay, yeah.
Okay. So if you're enrolled in Medicare Parts A and B, but you're still an active employee of USG, you would be on the USG plan and you would not be transitioning off because you are an active employee. When you decide to retire, we would suggest letting USG, your school, know well before, maybe 3 months or before, that you are interested in retiring, so that they can let us know at Aon Retiree Health Exchange that we need to reach out to you and make sure that we're getting you enrolled in a timely fashion.
And that's one thing, we will be working very closely with the HR offices and making sure they're communicating to active employees as you're getting ready to retire. It's going to be very important that you notify the HR office well in advance so you can do all the things that you need to do. Make sure we get the information to Aon, and you can go through that enrollment process and have plenty of time to make your decisions.
Okay, great. I actually believe you just answered. So their follow-up was, how much in advance of retirement do we need to choose supplement coverage?
So that would be, as I said, as soon as you know you're retiring, you talk to the HR department. We'll set up an appointment with you, and we can, the great thing to do is when we know what your retirement date is, we'll be able to enroll you well in advance. We can, I think it's a 60-day period of time before your retirement date that we can enroll you into the plan of your choice.
My spouse is currently employed. She is not Medicare eligible. If I drop her from my coverage, when she retires, can I reestablish coverage, even if she retires before she is Medicare eligible?
So I think I kind of touched on that in the question before, but if you, that would be a qualifying event, your spouse losing coverage. So as long as you're covered, you have the retiree coverage through the USG plan. If your spouse loses coverage, that is a qualifying event. That would be an event in which you would be able to add her to the USG coverage. If she's not, he or she is not Medicare eligible, they can go into the USG plan. If they're Medicare eligible, they would need to enroll in Medicare. Medicare would be primary, and then they would be enrolling in the supplemental coverage on the exchange. Did I answer that? It is within 30 days. Within 30 days, great point, yes. So you would need to notify the HR office within 30 days of that loss of coverage or that marriage event to let them know so we can get them enrolled in the coverage.
Are drug plans or are they not a guaranteed issue?
The Part D prescription drug plans, you do not have to answer any underwriting questions. So, I mean, guaranteed issue does not apply with them. You're able to enroll with them if you have Part A or Part B only. As long as you have Medicare Part A and or B, you're able to enroll into a prescription drug plan. No questions asked.
Okay, great. So this next card has 3 questions. How is the Aon Retiree Health Exchange being funded?
And I'm guessing it's how are we compensated? Aon Retiree Health Exchange is compensated by the insurance carriers once we enroll an individual into the plan. So they're paying us as an organization a commission for enrolling individuals into the plan. Our leadership is the only individuals that actually know what that commission is. Our benefit advisors do not know. People at my level do not know either, nor do I want to know, because our jobs are to make sure that we enroll you into a plan that you want to enroll in. We will never steer you to a plan, a carrier at any point. It makes no financial sense to us to do that. So we are paid salaries.
Does its funding come out of the state money budget for retirees, or does it have separate funding?
If that's talking about how Aon retiree health care is paid, it's not coming from USG. It's coming from the carriers once we enroll an individual into a plan.
Okay. And the last question, does the website contain a network of doctors with their specialty area, training, education, experience, etc., or offer information that we need when we're selecting a doctor?
On our website, you will not have that information, but you are able to go to any carrier's website on the web. Simply put in, if you go to Humana and you put in your doctor to find out if they're in the network, it will give you what their specialties are. But that's the only place, or the doctor's actual website, which will cover all of that information.
Can I pay Aon for advice on choosing a plan if I'm not a GSU retiree? My husband is on Medicare, and I'm here getting info from my parents. My father is a GSU retiree.
All you have to do is call us. Our service is free of charge to everyone. So if you are not age 65, if you are not a USG retiree, we'd be more than happy to answer your questions and help you find a plan.
Is the account being set up termed an employer-provided plan under Medicare regulations?
Repeat that one more time, please.
Is the account being set up termed an employer-provided plan under Medicare regulations?
I'm not sure.
Is the account being set up?
I got my glasses on.
Okay. Is the account set up being termed as an employer-provided plan under Medicare regs? No, it's not, right. It's individual plans.
Yes,
Yes.
individual plans.
Why the change?
Why the change? Okay. This is one of the things that we covered during the April retiree meetings. We went into some background and details about why we're making the change. So I won't go into a lot of detail other than to say that this is one of the things that the Board of Regents asked our office to address because of rising retiree health care cost and our rising liability, the system's liability for retiree health care costs. So the change is being made to make sure that we could really preserve and sustain the retiree benefit, and this is one of the ways that we could do that. There was a lot of evaluation, a lot of analysis, and we pulled in consultants, we worked with a committee, and we looked at all of the different options, and this was the option that was recommended to our office, just really as a way to preserve the retiree benefit. And if anybody wants to talk more after the meeting, I'm more than happy to stay and talk with them.
Can you elaborate on this? I mean, if you have limited funds, now you have less limited funds because of this new program?
So again, like I said, I'll address it, and then if we want to talk in more detail, I'll be happy to. But again, when we were looking at the amount, okay, there were many different options for us. This was the best option for all of our retirees, to give all our retirees many options to choose the best coverage for them. And it was a way for us to really maintain our retiree health care costs. So when I talked about the amount that retirees will receive in 2016, we had two goals in mind, and one of those goals was that USG costs will remain the same. So every year those costs rise. So we were able to meet that goal with this change, and by doing that, we're going to be able to remain committed to providing a retiree benefit. So
If Silver Script changed because it was only for 1 year, so now we'll have in 16 or 17 more changes coming?
we don't anticipate that. Like I said, when Tammy said, when you enroll in a plan for 2016, that plan will continue into year over year unless you want to make a change to that plan. So we do not anticipate going through this every year. Once you choose the plans this year, those plans will continue.
Next question. How does it affect us compared to the previous system, the cost, Do we have a choice?
Okay. How will this affect us? Again, this is a big change for everybody. I think we've talked about we wanted to give you information so you can get an idea of what those premiums will look like. If you want more information, there's information on the website right now available to you. So retirees will have a choice of a number of different plans. And you will be able to make the decision on the kind of plan that you want to enroll in and what that premium will look like. When we looked at the premiums and the exchange, and we did a lot of analysis over the summer and looking at what the premiums are today in the exchange, and again, that's where we came up with determining what that contribution from USG would be. So we wanted to make sure that retirees are not paying any more in premium in 2016, and that USG costs remain the same as well. So there was a lot of thought, a thoughtful analysis that went into that.
How is it determined how much money goes into the individual HRA account?
Okay, was that answered already? You want me to review that again? Okay.
Which expenses have to be directly paid by the participant? And does medical bill get submitted by the provider?
Good question. So you are able to be reimbursed for your premiums for your Medicare Advantage plans, your Medigap plans, your prescription drug plans, your Medicare Part B premium, your co-payments, co-insurance, and deductibles that you may have on the plans. Now, your premiums can be auto-reimbursed through the carrier. Co-payments and co-insurance, you would need to submit a claim form to have those reimbursed. And what was the rest of that? Did I miss something on there? Okay.
No, that was my question. My other part was, does the doctor or the hospital
Yes.
provider issue the claims to the Medigap insurance?
Sure.
Or does the participant have to pay those bills and then submit?
Okay, so if you are enrolled in a Medigap plan, remember Medigaps work side by side with Medicare Parts A and B. So your physician or hospital will bill Medicare first, and then they will send the remaining balance to the Medigap plan for payment. You will not see anything there depending upon what plan you choose to enroll in. Now, if you have co-payments or co-insurance or some type of deductible that you choose to provide because of the plan structure that you decided, you'll be notified on that what you need to pay. A Medicare Advantage plan, those are the plans that are administering your Part A and Part B Medicare benefits. And the physician is going to bill that carrier. When you have a Medicare Advantage plan, it's one card. You're going to hand that to your doctor or hospital or your pharmacy for your coverage. They're going to, your doctor or hospital is going to bill that specific carrier for the services, and if there was a co-payment or co-insurance that you would owe, they would then send a follow-up bill to you so that you could make that payment. Some physicians, when you have co-payments, they require that up front when you go into the hospital. So it's however the doctor runs their business office.
Are there separate calls with the benefit advisor for the retiree and spouses to choose plans?
Good question. There can be if you wish, but you don't have to. Normally, they are a joint appointment because what you're hearing is basically the same education process. When it gets down to plans is where the phone call will be a little bit administered towards the retiree or the spouse. If for any reason when you receive your education kit that you notice that you have individual appointments, when you call to confirm your appointment, just let us know that you want them together, or if you don't, let us know that too, and we can make 2 individual appointments. But the majority are joint appointments.
Can the funds be used to pay the annual fee, MD VIP healthcare providers?
MD VIP healthcare providers.
Oh, concierge medicine.
Concierge.
No, they cannot. The HRA is set up to pay for Medicare premiums, for your health care plans, out-of-pocket expenses such as co-payments and co-insurance, but not concierge services.
Is the BCBS terminated?
The Blue Cross Blue Shield plan, yes, for retirees age 65 and older, that plan will end at the end of the year. Yes, Blue Cross Blue Shield will be an option in 2016. Kaiser will be an option in 2016 on the Aon Retiree Health Exchange, correct.
And the last one, is SilverScript canceled?
SilverScript, right. The USG SilverScript that will end at the end of the year. SilverScript will be an option for you in 2016. So SilverScript is available on the Aon Retiree Health Exchange. So if you'd like the SilverScript coverage, that's available, but your Aon Retiree benefit advisor will work with you on that.
What happens if you need to retire during the school year due to health issues? Can you enroll then? If so, how do you do it?
Yeah, I think we talked about this already, that if you need to retire next year, just make sure you reach out to the HR department here at GSU. They'll get the information to Aon, and we will get you enrolled in the coverage at the time you retire.
My spouse and I are both USG retirees and have our own insurance coverage. Can we still use the HRA accounts interchangeably? For example, if I do not use all my funds and need additional funds, can they be used from his expenses?
Yes.
Yes.
Yeah, that is correct. So that's a joint account. I think we talked about it. If the spouse and the retiree are both covered under the exchange, $27.36 for each one will be deposited in a joint account, and both can utilize those funds.
Can one go back to Medicare, Medigap coverage once enrolling in Medicare Advantage?
And I think we covered this one earlier. If you are in a Medicare Advantage plan that first year of your plan, you do have a free look, and you would be able to, with certain carriers, and you would be able to enroll into a Medigap plan with guaranteed issue. Any year after that, you would have to answer the underwriting questions on the application.
I'm on Kaiser's Senior Advantage program. What HMOs are included in the Aon plan or the Kaiser plan?
At this point, I am not able to tell you what HMO plans are covered. The 2016 plans will be out in October, so your benefit advisor will be able to answer that better.
Okay, this card has 4 questions. Do we get a list with details of all the plans to be offered?
If you go to our website, once you receive your education packet, you can go online and look and compare all of the plans that we offer. Now, there are a couple plans out there that you will not see because of contractual obligations, such as United Healthcare. They only supply their information on their website only. You will not see United Healthcare on our website or on anyone else's website for that matter. So that's why you'll want to have that conversation with your benefit advisor. But that's their choice, their contractual obligation. But you can go out there and see what other carriers are out on our website.
Second question, is there a plan similar to our plan with Blue Cross Blue Shield?
I don't have your documentation in front of me, but I'm sure there is something very similar to your coverage, and your benefit advisor is going to know what plan you're on, and all you have to do is tell them that you want something very comparable to that, and they'll help you find that plan.
The third question, how do we get the Medicare D drug plan?
How do you enroll into a Part D prescription drug plan? When you're having your conversation with your benefit advisor, remember I said we're going to need a list of your prescriptions, what you take, the dosage of it. Your benefit advisor is going to help you find a Part D prescription drug plan and help you enroll into that coverage.
The fourth question I'm having a hard time reading, so if you're here, you can kind of clarify, but they're asking about the $2,736, but it's very difficult to read. You guys can,
Let's take a look.
Who sets up an ask? Oh, they're wondering if they need a separate bank account to house the 2736. So you're not setting up a private account for the 2736. The 2736 HRA is not deposited into a personal checking or savings account. If USG did that, you would need to be paying taxes on that money. It's a reimbursement account that USG has, and once you make a premium payment or a co-payment or co-insurance when you send in a claim for that expense, then you're reimbursed from the USG account. And that's why it's a reimbursable account. Now, if you want to set up your own private, personal, separate checking or savings account for that money to go in and out of, you can do that if it's easier for your budgeting purposes. But that's your decision. But it will be reimbursed to you. It won't be, the full amount will not be deposited into that account.
You covered if you are covered for Medicare A and B and still working at GSU, but what if you're working elsewhere?
Okay, so this is somebody that's a retiree of GSU and is working elsewhere. Then Medicare Part A and B, you have some options at that point in time, and we may need to discuss because that's a unique situation. There's some options, but you would need, in order to get that HRA contribution from USG, you would need to be enrolled in Medicare Part A and B and then purchase coverage on the exchange. So,
Can we contribute pre-tax money to the HRA account?
No, you cannot. If you did contribute, it's not like a health savings account. The money is coming from USG as the benefit to their retirees. So you are not able to deposit money into the account.
oh, thank you. My doctor has just said he will no longer accept Medicare exchange plans. If I am on a Medigap plan, does this mean Aon's plan will not be accepted?
Now, there really isn't an Aon plan, so as long as your doctor accepts Medicare, you can enroll into a Medigap plan because the doctors are going to bill Medicare first because Medicare pays first, and then Medicare is going to send the remaining balance to the carrier of your choice. So they really don't have anything to do with the carriers. Now, if the doctor is talking about a specific carrier in a Medicare Advantage, we all know some doctors don't take certain plans. We will know that when we run your doctors within that carrier, and we can let you know if they're in or out of the network.
and I'm wondering if the question is more, what if your doctor doesn't take Medicare? Is that the question? What if your doctor doesn't take? Oh, that was not the question. Huh, interesting, okay.
Yeah, so if he accepts Medicare and you enroll into a Medigap plan, they're going to bill Medicare first. And then Medicare will send the remainder to the carrier for processing.
So there must also be out there in the big wide world, some Medicare exchange plans that we're not being concerned with here.
That I'm not aware of. The Medicare plans are either a Medigap plan or a Medicare Advantage plan, which are offered by many different carriers.
So my wife is not yet 65 and will continue on the USG plan. Will our current method of payment in bank draft continue in order to pay her premium, or will we have to end this bank draft and start a new one?
Great question. We didn't cover that. So yes, if you've got a dependent, say your dependent spouse is remaining on the USG plan, that draft, the way that we debit your account, will remain the same for 2016. Okay. That's it? Any other questions?
We
Okay.
have, this woman back here was just about
Okay.
to write one. Could you possibly bring the microphone to this young lady? You'll need to hold a little bit closer. There you go.
The advisors, how well versed are they with the Medigap companies? For example, I was trying to think about how to phrase the question when you handed me the microphone. I'm sorry. It is my understanding, and I could be completely incorrect with this, but how the premiums are decided with the Medigap policy has to do with the individual insurance carrier. And some of them determine premiums based on age, some age of enrollment, some increase premiums every year because your age increases, some determine premiums based on the community that you live in. Are these advisors versed on this so that when you decide which carrier you want to go with, you know how their premiums are going to be increased each year? And will they have a history of the carrier's premium increases?
Okay, so her question was, how well versed are the benefit advisors with the carriers? Because carrier premiums, not only are they based on age, gender, location, and tobacco usage, but the way they're structured is different as well. The premiums can go up based on when you enroll into the plan, maybe 4 or 5 years later. It could be based on an age grouping. You enroll in, your premium is this if you're between age 65 and 70 or 75 and 80. There's community rating. They're all different, and it depends on what areas you live in. Now, your benefit advisors go through an extensive training every single year with each one of these carriers. And if anything changes with them, we know about it. The way the premium structure is set up, yes, they are experts in the field of letting you know how the premiums will go up each year. They actually have the summary of benefit for each one of these plans, which has all of that information included in the summary of benefits. And when they mail that out to you or email it out to you, you will also have that in writing. So they know exactly what the plan offers and how the premiums are offered and how they go up, or the ranges that the premiums are offered in. So they will know that. So with Medigap plans, what we've seen, you know, some of the Medigap plan premiums, they do go up, not very frequently. I mean, once every 3 to 5 years is what we've seen on average, and maybe a 3% increase. Medicare Advantage plans have star ratings. You could go out to Medicare.gov today and take a look at the plans that are in your areas, and those are rated as star ratings for their customer service. But we don't have that type of rating on Medigap plans. They can tell you, because of all the carriers they've worked with and the individuals who have been on these plans, how individuals like them and how the customer service experience has been. But there are no star ratings on Medigap plans.
Can HRA funds be used for dental or vision costs if you don't have the GSU dental and vision plans?
Yes, it can be
Yes,
used
ma'am,
for,
they can.
right, for out-of-pocket dental or vision expenses. Yes.
Great.
I'm not yet, excuse me, I'm not yet a retiree, but I hope to be one by about this time next year. So the question is to Aon, will I receive all this information kit, enrollment procedure now or later or what?
When you decide to retire, just let the school know about 3 months before you decide on your retirement date, and then they'll let us know at Aon Retiree Health Exchange, and we'll send you out an education kit with all the information. It will have a scheduled time and date for your appointment, and you would be able to confirm that or change that. But a good rule of thumb is let us get you enrolled at least 30 to 60 days prior to your enrollment date, or your retirement date.
Yeah.
It's premature, but good thing, you're thinking ahead, which is good. And especially because you want to let us know when you're going to be retiring so that you have coverage when you retire. Well, in all plans, no matter where you are, if there's an emergency, you're going to go straight to the closest hospital, right? And some Medicare Advantage plans do have emergency coverage. Now, when you think about it, if you're out of the country, Medicare is always going to pay first no matter what, and you'd have to pay the expense first and be reimbursed by Medicare, but there would be some type of coverage. Correct, correct. Travel insurance would probably be your best bet. And for everybody else, if you don't know this when you're on cruises, if you're out in international waters, totally different ball game. Make sure that you take out insurance there because you're within different areas. And they do suggest that if you're somebody who likes to cruise, take out the insurance through the cruise.
I think we got one more question. Okay.
At once it was reported that when all of the health care changes were taking place in the marketplace, that Medicare Advantage plans might not be here to stay. Do you remember that, or could you comment on that?
Now, Medicare Advantage plans are the original Medicare plans that came out back a few years ago. The Medigap plans are actually the newest plans out there. We have not, they've talked about it, yes. There has been no decision, and we would know directly from the carriers. In fact, we'd know from the Centers for Medicaid and Medicaid Services first if they're going to go away. So at this point, I don't have that answer. What I can say, though, is with some carriers, no, they will have 5, 6, 7 different types of plans, Medicare Advantage plans, and one of those plans could go away within a year, and they'll still have many more. If that happens to you, you would have a special enrollment period into any other plan of your choice. But as far as all of them going away, we have not heard that.
Anything else? Okay, thank you, everyone. I appreciate it.
Thank you.
Thank you.